I think in the last 20 plus years, we've learned so much about inflammation in the skin. And it's really applicable not just to psoriasis, but atopic dermatitis as well. And I think because of these incredible discoveries, the discovery of various cytokines and interleukins, as we call this, have really been quite helpful in launching our understanding of these inflammatory disorders like psoriasis, but it is also translated to atopic dermatitis as well. And I think it's one of the reasons why we have such a plethora of drugs that are going to be coming in that space as well. And of course, while, for instance, we have 11 approved biologic therapies for treating psoriasis right now. I think from a practical standpoint, and I practice in the trenches as well, we see these outcomes. And I think when we think of clinical studies and clinical trials, we think of how the skin looks. But I think the new generation, not only of studies, but discussion, is really how patients feel. Patient-reported outcomes, PROs we call them. And so I think those outcomes have been significant, particularly with our first systemic biologic therapy for atopic dermatitis. And we haven't had anything really in many, many years to treat this condition except for topical therapies. And it's not really an outside disease, it's an inside disease, much like psoriasis in that regard. I think the sooner we treat any disease state, the better, most any condition. But where autoinflammatory diseases like psoriasis are concerned, the less inflammatory burden that I receive from my patient, whether they're coming to me directly or from a primary care physician or from other physician colleagues, the sooner I see them, the better. And because I can intervene once again with this plethora of agents that we have right now. And I think the important story now is that we can practice precise medicine, precision medicine. We can treat this heterogeneous condition like psoriasis and its host of comorbid conditions associated with it, and tailor the treatment specifically for the presentation to the patient. So the earlier we see them, the better, and we can jump on their condition and understand their particular presentation, because each patient's going to be a little bit different. Their comorbid conditions, their medication profiles are going to be a little bit different, and we have agents right now that can allow us to be able to tailor our treatment protocols for those individuals.